there's a lot of things that impact our pain experience. And I think everyone on here is going to say stress impacts my pain. If I have stress, I'm in a lot more pain. And we're all under a lot of stress now, right? So things are crazy and we have a lot of stress in our lives and we're dealing with things in ways that we've never dealt with before. So I think pain in general is increased sort of in every person I've talked to just because of the circumstances. So what's going on in your life affects your pain, and it affects your ability to cope with your pain. So what was fine yesterday, today, when the kids are screaming and the dinner's burnt and, your work just called and this, that, today you can't do it. And so there's sort of that level. There's how you're feeling. So if you're otherwise ill, you may have more pain. If your other conditions, whatever they may be, are not under good control that day, that can contribute. Poor sleep, sort of you name it, and it can do. Weather is always a big one. I think there were some questions about that. My patients ask me that every day. And absolutely, it clearly does, right? Can I show you the study that says weather impacts your arthritis? No, I cannot. But I don't care because I know that it does, because every patient I've ever had says that. And whether that's barometric pressure or humidity or what that is, what those, a lot of people after a couple of years figure out a lot of these triggers, right? So it's going to rain, there's going to be a hurricane. I might as well just not even do that today. And learning, what your body's triggers are and what kinds of things are going to make your pain better or worse is sort of part of the process of having one of these chronic conditions.